Hey friends, welcome to Bindu's Point. Today I would like to show you a video on like how to get your primary physician and why is it important in US. Hope this video is helpful to you. Here in America, you need to have a primary physician. Like what happens in India, like suppose you move from one city to another city. The first thing you will think about is like just getting a house for rent, and then which schools you will kids go get admission into, and so on. So here also, yes, here also we do all those things, but in India we don't really bother about who will be my doctor until unless you fall sick. And when we fall sick, we just ask our neighbors which is the best doctor, and we just go and visit any doctor. Like in fact, you can just see whichever hospital is nearby and you just go directly there. That will not work in America, because first thing is, like, first of all they will ask, are you a patient, or are you our patient, are you registered here? Then you have to, if not, then you have to register. Then there will be questions like, okay, do you have an insurance, and do they accept that insurance, and so on. So it becomes really like if you don't have any primary physician, and after falling sick, if you are trying to get in medical care, it is very difficult. And if you directly go to any emergency center, then it will be very costly. So that's why we have to have a primary care physician. So how do we get that? There are the options are, first of all, do you have a health insurance? You have to take a health insurance. Or if you don't have, also fine, so you can go ahead with, okay, I don't have an insurance, like I am going to pay from my pocket. Then you will choose the doctors. So usually the good practice is, if you have a health insurance, you can go out, check out on their website which doctors are covered, so which doctors are accepting that insurance. So in my case, okay, we had Aetna CVS health insurance, and at the same time, going to their website and checking can be cumbersome, and it's not that easy. And you don't know whether all those doctors listed there are really good enough. So how I do is, like, I just ask my friends and neighbors which doctors they are going to, then check out the Google reviews, or maybe I will go to Google and check out the doctors nearby. And then I chose two of them, and I called the first doctor, and then they responded with, okay, what is your insurance? And they said they don't accept my insurance. So then I called the other doctor, and they do accept that insurance, so I went to that doctor. So that can be an easier way. Okay. And sometimes, like if you don't have an insurance, also you can call the doctor and tell the office. Usually the receptionists are the ones who are talking to you, so they will tell, like, okay, fine, like I don't have an insurance. Some can tell, no, we don't accept patients without insurance. Some can accept patients without insurance. Okay, so they will as well tell, okay, we will send you the form, you can register online, or you can walk into their office, and there you can register yourself. So let me tell you what are the next steps. Okay, let us say, like, you don't have insurance, and there are doctors who are accepting patients without insurance. That does not mean, like, you fall sick today and you can just get an appointment for, today or tomorrow. So let me tell you my experience. So what happened, like, because I was looking for the doctors, and like I told you, my friends referred me two doctors. One was Hamsa Gangadharaya in Gangaswamaya in South Brunswick, and another was Dr. Aruna Chakrala. So first I approached Dr. Gangaswamaya, and I called them, and they told me, okay, give me your email address. Like, you can send your insurance card and your ID proof and your, name and other details. You can reply to that email. So yeah, I got their email, and so I replied to that with my insurance card and ID proof and other details. And then after and even then, like what she said was like, okay, even like if you are coming as a new patient, your first appointment will be in the middle of next month. So it's like almost 45 days I had to wait for the first appointment with that doctor. Okay. So I said, like I asked them, like what if I once I am registered, even then is will it be, like do I have to wait so many days for an appointment? She says, no, no, like once you are our patient, you don't have to wait that much long. So you will get appointments quickly. And if it is really serious or emergency, you can just walk in also. Okay, fine. So I sent my details and I waited for the response. And I think within 2 3 days, they called me back and said, sorry, we don't accept your insurance. Okay. So then I said, okay, thank you. And then I called Dr. Aruna Chakrala. In fact, it was going to their a voice message box, and like I did not get a response. So I just checked online and I found that I could register as a new patient online. So I went there and I registered. So it asked for my name, address, and again insurance card image and ID proof. So I uploaded my driving license, and then I got a call from them, and they asked me like, okay, we were trying to get an appointment for Friday or something, like yeah, I think it didn't go through. So can you come on Friday? So I said, okay, fine, and I went there. But again, there I had to like re-enter all the details again. And I yeah, I think yes, I also needed to see the doctor because I was having my like I was having severe pain in my hand. So I had the appointment, so I checked in, and like I had to pay $50 yeah, for my like with my insurance card. And yes, so the checkup was there. Like maybe I can make another video on my experience there. So this is how like you get into a primary physician. Like maybe like all your family can go to the same doctor, or if your husband wishes to go to another doctor, he can go to another doctor and he can be his primary care provider. Usually one family will go to the same doctor. So here in this with the doctor I went, so there are like it's a clinic with four doctors. So like if men feel comfortable with like male doctors, maybe husband can choose them, or females, like if you are more comfortable with lady doctors, you can be you can take appointments with them. Depending on like whatever is comfortable. And for kids, we have to find a pediatric doctor. Okay, so this was my experience with like finding a primary care physician. And I hope I told you enough about like why we need a primary care physician. And like most of the time, for any problems, you cannot directly go to other doctors. Of course, nowadays, like gynecologist and others, you can directly go, and they can like there also you have to register as a patient. But any doctor, then all this process you have to follow. You don't get an appointment for today or tomorrow easily, unless you are their current registered patient. Okay. Also in emergencies, like maybe something happened there, you just fainted somewhere, and like someone had to call an ambulance, and they have to take you to some doctor. So immediately, if you have your insurance card, and they can just grab all your history, all your report, like and it makes it much more easier and safer for them to start giving you medicines. So they will know your medical history, what you are allergic to, what whether you have already gone through any surgeries and other things. And immediately all this data will come to your primary care physician also. Recently, like one of my family friend had like he just fell somewhere, and like he was taken in an ambulance to some nearest hospital and was treated there. But next day when we went to his primary care physician, and he was trying to explain him about the things, he already had all his like x-ray reports and everything that was taken in the hospital the previous day, because once he has given his insurance card and ID proof, they know who is his primary care physician, and immediately they have shared all the details with his primary care physician. So there are many more reasons, like why primary care physician is really needed in case of such emergencies. It is important to have a primary care physician in US. Thank you. I will make reviews of my physician in the next video.